A bachelor's degree in psychology therapy. Published by Education Web. A bachelor's degree in psychology and its relationship to the field of therapy or counseling. Understanding a bachelor's degree in psychology and the path to a therapy career. A bachelor's degree in psychology (Psy) is a crucial and fundamental first step for anyone interested in human behavior and mental processes, and who aspires to work in the mental health field, including therapy and counseling. This program, which typically lasts 3.5 to 4 years, provides a broad scientific foundation, but a bachelor's degree alone is generally insufficient to practice as a licensed clinical psychologist or independent therapist. Core curriculum and focus of study. The undergraduate psychology program focuses on providing a comprehensive understanding of the science of psychology. Students will study various aspects, including fundamentals of psychology, an introduction to major theories, the history of psychological thought, and professional ethics. Research methods and statistics, essential skills for designing studies, collecting and analyzing data, and thinking critically. Subfields of psychology. In-depth coverage of psychology such as clinical, developmental, child to adult, social, cognitive, physiological, biological, and industrial and organizational. Therapy-based coursework. Many undergraduate programs, especially those offering specific concentrations, will include courses relevant to therapy, such as personality theories, psychopathology, mental disorders, principles of counseling, psychological assessment. Some institutions even offer more focused undergraduate programs, such as an honors Bachelor of Counseling Psychology or a pre-counseling concentration in applied psychology, which include more counseling coursework and relevant field experience, practicum. Bachelor of Psychology as a career foundation. A Bachelor of Psychology degree opens up a variety of career opportunities in various sectors, although not directly as a licensed therapist in many jurisdictions. Graduates can use this degree to work in sector. Possible initial roles, contributions to the therapy, mental health field. Mental health staff, worker, case manager, disability counselor, residential worker, provide emotional support, service coordination, guidance, and assist with the implementation of therapy programs under supervision. Pipe. Education, educational counselor, guidance and counseling staff, help students overcome learning or social problems and facilitate personal development. Pipe. Human resources, HR, selection and recruitment staff, training and development staff, apply psychological knowledge to employee assessment, conflict management, and workplace climate improvement. Pipe. Research, psychology research assistant, contribute to studies related to mental health, behavior, and the effectiveness of therapy interventions. Pathways to professional therapy practice. To become a licensed clinical psychologist, therapist, or counselor who can provide psychological interventions and therapy independently, postgraduate education, master's or doctoral, is almost always required. Bachelor's degree, Psy, completion of an undergraduate program in psychology, counseling, or a related field, a mandatory first step. Advanced education, S2, S3, continue on to a master's, S2, in clinical professional psychology or a master's, S2, in counseling psychology, psychotherapy. These postgraduate programs will provide intensive training in therapy theory, intervention techniques, diagnosis, and supervised clinical practice. Structured clinical experience, completion of hours of clinical practice under supervision as required by a regulatory body or professional association. For example, becoming a clinical psychologist in Indonesia requires professional practice experience. License, registration. Obtain an official license or registration from a professional body in the region, country where you practice, e.g., a clinical psychologist practice license from the Ministry of Health in Indonesia or registration with a counseling association. Why are advanced degrees important? A master's or doctoral degree is crucial because it provides in-depth knowledge of various therapeutic models and psychopathology, offers intensive practical training and clinical supervision necessary to master therapy skills, is a prerequisite for obtaining a professional license in most countries. A bachelor's degree in psychology is essentially an entry point into the world of mental health, providing you with a strong foundation of knowledge. However, to truly become a professional therapist, your education must continue to the master's or doctoral level.